If this group was successful in a year's time, I expect to have good representation for the scientists and the pharmacy workforce, reflecting the complexity of their education needs.
For me, success of the LETB will be that all our providers and education providers are working well, and we have worked out what the priorities are for providing a future workforce that is high performing, provides quality for patients that we serve in the Cambridgeshire health system.
For me, success will look like excellent partnership groups from the higher education institutions and our providers, where continuing professional development will be delivered with a real focus on patient care and effective patient care.
Success for me, for our area, will be that all the providers are working collaboratively and cooperatively to drive up the standards and the energy and the outcomes that we want with looking after and training and developing our excellent workforce across this area, and that we will be renowned for the sector that people want to come and work with and work in, because we look after our staff and develop them the best.
Success for me would be continued support or increased support for all of the youth engagement programs that we're currently running.
Success for me would be good communication across all levels of the organisations.
Success for me in a year's time would be greater working partnerships, closer working partnerships with the Open University and the trusts and the county workforce in this area.
If the Cambridgeshire and Peterborough Workforce Partnership event is successful today, we'll all have a very clear idea of how we can work together to improve education for the practitioners in Cambridgeshire.
Success for me would be three things. One is that we will be able to make a demonstrable difference to the patients in the way that we deliver education. The second thing will be that we get people to look over the hill to the next 5 years, not just the next 6 months in terms of workforce. And the third one is that they'll be the best LETB that they can be.
I'm very supportive of the LETB initiative, and I would judge success in the first year by an improvement in quality of our training across the board, particularly with a focus on patient safety. I'd also like to see some streamlining of our mandatory training across organisations so that that can also be smoother and can be recognised between institutions.
Success for me would look like a better quality of training for all our workforce and a more streamlined approach to workforce planning for the next 5 to 10 years.
I think success for me would be that we've improved the quality of education across all of the professions involved in the delivery of healthcare.
To me, success in the year would be if there's increased collaborative working between all the partners and an increase in innovation to change services in the locality and the rest of the county.